Welcome and good evening, and welcome to the Family Centre's new series of live interviews with experts talking about how diabetes impacts particular areas of our bodies and our health, which we kick off tonight with a conversation with dental therapist Robyn Riley. My name's Bec Johnson. I'm delighted to be your host here tonight for tonight's webinar, in which we'll talk teeth, amongst other things that are related to dental and oral health, of course, with an expert who's not only a dental health practitioner with more than 30 years of experience, but also someone who knows type 1 diabetes inside out as the mother of a daughter with type 1. Before I welcome Robyn, I'd like to acknowledge the traditional owners of the land upon which we are creating this education event this evening, the Whadjuk people, and acknowledge their elders, past and present. The reason why we're here tonight is because our community told the Family Centre loud and clear in our recent engagement survey that you wanted more information about the different elements of the body and how they're impacted by type 1 diabetes. And that includes aspects of our physical body, including our eyes, our feet and our kidneys, along with, of course, our teeth, which we'll discuss tonight, but also our mental health. And to that end, we've not only kicked off our mental wellbeing and mindset series last week with the wonderful family therapist Joe Solowajak, and then we'll be continuing that with a series of experts on the topic from the United States. But we're also putting together in the coming months a series of educational webinars with local experts, and we'll be focusing on the physical aspects of diabetes and how it impacts our eyes, our kidneys, and our feet. And they'll be happening right here in this community live, and we're targeting them around giving you a really solid understanding of the health area, the health risks to you as somebody impacted by type 1 diabetes or the parent of a child with type 1, and of course, because this is what the Family Centre does, some practical tips and strategies on how to get healthy and stay healthy. This is an interactive session and we want to be able to answer your questions, but in order to be able to answer your questions, you've got to ask them. So please do post in the comments and we will then endeavour to ensure that any questions you have about what we discussed tonight will be answered. Welcome, Robyn. Thanks so much for being here tonight. Tell us a little bit about you and your experience.
Well, as a dental therapist, I went to Curtin University and graduated in the early 90s. And have had a mixture of working in private practice, general practice, government services. I was lucky enough to spend 6 years on Christmas Cocos Island, where I saw all sorts of different and wonderful teeth experiences, but was absolutely amazing. And then it was actually when we got back from Christmas Island and in Perth, and I started working in a specialist paediatric practice, that my daughter got type 1 diabetes, and we were thrown into the world that all of us know too well. So I do know that there were times, especially in those early years, where I was probably not the best dental therapist when I put my child to bed, because it was a night when things were not going well with diabetes. She was not happy to have that Lantus injection. You know, I was crying, she was crying. We've just been going through this for an hour, and I probably wasn't going to floss her teeth before she went to bed that night. But it's what happens most of the time that matters, not what happens on one night. So we do have to, with all the messages I say tonight, that is what we're aimed for. But don't beat yourself up if one night it doesn't happen. It's okay. It really is. You know, we don't want to be too hard on ourselves as mums either, and dads and selves. Yes.
Oh, thank you. I think that really frames it up around reaching that balance, which we're all striving for. I think living with type 1 diabetes, and it's a hard balance to strike sometimes. And I think that message around getting it right as you can and doing your best most of the time is a really powerful and important one. Now, you and I actually started this conversation about doing a live in the group about 6 or 7 weeks ago, when a piece of research was released that certainly made me and the team at the Family Centre stand to attention. And that was a cross-sectional study of young people at the Royal Children's Hospital, so an Australian study, which found that 58.7% of study participants experienced dental cavities or decay, and that included some advanced and quite serious dental decay, and 62.5% of participants had moderate gingivitis, which is gum disease. So those stats again, 58.7% had dental cavities, 62% had gingivitis, and wait for it, only 6.3% of the study participants had healthy gums. Now, just for a bit of background on this study, the researchers noted that the participants had an average HbA1c of 7.7%. So half of the participants were below that, half were above, and half the participants reported having at least 3 or more hypos every week, which obviously required management with fast-acting sugary carbohydrates. A little bit more, a third of the families involved in the study said they regularly gave their kids snacks prior to bed or overnight to prevent overnight hypoglycemia. Hands up, we've all done it. I was eating a muesli bar at 11 o'clock last night when I saw that my trend was dropping. So it's a thing, and I think that is really telling on just how regularly we are needing to treat hypoglycemia or prevent hypoglycemia with rapid-acting carbohydrates. So the study authors said these findings were of major importance. We agree. And to make this study relevant to adults, I just wanted to look around to see what there was out there for adults. And I found quite a few studies that agreed that dental health is also a big issue for adults with type 1, that both glycemic control and duration of diabetes are 2 of several factors. And there are factors outside of having diabetes that impact predicted poor oral health, about how often you go to the dentist and how often you brush your teeth, of course. But glycemic control and how long you have diabetes were factors that predicted poor oral health. And so we decided to beam this conversation out to both our parents and our adults communities to include everyone, because clearly this is an issue for people of all ages. Robyn, can you tell us what your comment is on this research? What do you make of it?
Yes, well, I did go and find the full article, and it looks like a really good study that is really well needed, because nearly all the studies are actually aimed at adults with type 2. There's a lot less with type 1 and oral health. So it's a great study. And the study did say that we actually need more and bigger cohorts in the studies and things like that. And it's really made me think a lot about why is it that our type 1s do have higher incidence of dental disease than the general population. And exactly what you're saying, Bec, you do think about they have to have rapid acting carbohydrates when they're hypo and those sort of things. And whereas they do play a part, the other side of that too is quite often type 1s are, when they're well managed, no, I don't like to say that term, but that they often are very they do see dietitians, and they do often have, in general, a better diet than the general population as well. So it's not all diet related. There's a lot of other factors in there as well.
Interesting. Okay. Thank you for those comments. I guess I just wanted to hone in on some of the terms that we just discussed in that research. Gingivitis, dental caries. We were discussing before the show the term periodontitis, which is, I guess, the escalation or the advanced gum disease post gingivitis. Can you unpack and define some of those terms for us just quickly, so we've got a bit of a handle on what we're talking about here? Sure.
So dental caries is the same as dental decay, cavities, holes in teeth. It's virtually all the same thing. With gum disease, the first stage of gum disease is what we call gingivitis, which is inflammation of the gingiva or the gums. And that is if gingivitis is allowed to progress, and the way it progresses is by lack of control of the plaque on that gingiva or on that gum, then it starts to involve the bone around the teeth as well. And that's what they call periodontitis, or around the tooth, inflammation around the tooth. So, and once you get bone being destroyed around the teeth, that's irreversible, whereas gingivitis is reversible. So that's why it's really good if we're having these conversations, because most children don't have, there is juvenile periodontitis, which is quite rare, but the majority of gum problems in children is gingivitis, which within a week can be totally reversed as if they've never had gingivitis. So it's a very doable solution. Yeah.
Okay. So what I'm hearing is a lot of these issues, if we head them off at the pass early with education and preventive strategies, we can actually resolve them before they become a problem. So that's Absolutely. Really good to know. I guess just to circle back a little bit, why is good dental health important for people generally, whether they have diabetes or not? And why is it especially important for people who have type 1 diabetes?
When you have advanced dental disease, or even moderate dental disease, it's basically a bacterial disease that is inflammation. And we know that inflammation and diabetes have a relationship with each other. So what is happening in the mouth can then therefore impact your diabetes and your control of that. But as a general sort of umbrella, if you don't have a healthy mouth, like children that have a lot of tooth decay, they often have just chronic low-grade pain that often it's not because it's always been there. They just think that's normal. And then it's not until it becomes quite acute that they may react differently to it, say that their tooth's hurting more, whatever. And that's when they often seek treatment, where their parents take them to have treatment. And then once it's fixed up, then you often see improvement in behaviour, improvement in concentration, improvement in all sorts of things, because that chronic inflammation and chronic pain was just not noted beforehand. I've seen so many cases of that.
Interesting. So it actually plays out in a whole lot of different ways in relation to our general health, including impacting, I imagine, our ability to sleep and concentrate, and therefore elements of mental well-being as well.
Definitely.
So let's get practical. We've talked about a few studies saying that this situation's not good across the board. How do we take action? How do we achieve and maintain good dental health? And can you give us some strategies around the basic principles of good oral hygiene?
Well, the good oral hygiene means plaque control. What plaque is, it's a bacterial growth that grows in everyone's mouth. And what we need to do is disturb that plaque or that bacterial growth so it doesn't colonise and become into more complex colonies that therefore produce disease. So the way to do that is with good brushing, so brushing twice a day for 2 minutes, and flossing, or with adults you can also do interproximal or little brushes in between the teeth as well. But it's the disturbance of that plaque that stops it from going from simple colonies into the complex colonies that is therefore gives off the dental disease. They feed on nutrients from a food, but we all need to eat, so that's going to happen. So we need to sort of think of it as bacterial disease, or bacterial inflammation.
So disturbing the plaque, which is the build-up of bacteria, brushing, flossing for kids, How often?
Well, in an ideal world, it'd be every day. But if you did it 2 or 3 times a week, that makes a huge difference. And I can just imagine all the mums out there and dads out there going, I can hardly get the kids to brush, let alone floss. And I know myself, even though I floss kids' teeth at work all day, when I was at home, I just had to make it as easy as possible for myself. And I used floss holders, and my routine when my kids were younger and I was helping them with their cleaning was I would get them to brush in the bathroom with the fluoridated toothpaste, spit, not rinse. Rinse their brush and dry it. And then when they went to bed, and I incorporated in the bedtime routine, is they would lay down, and with the brush, I would go back around the gum lines, because that's where the plaque tends to collect or starts to be produced first, is around the gum lines. And it's where the kids don't have the dexterity to do it really well. And kids don't have that dexterity until they're about 9 or 10. So when they were laying down in bed, I don't worry about the toothpaste at this stage. We've already done that bit in the bathroom. I just go around and manually or mechanically disturb that plaque on the gum lines with the toothbrush. And by having them laying down, it means that you can see well, their head is supported, you just go over it. Whereas if they're sitting and standing and you're putting a toothbrush before them, all they have to do is this, and then you're sort of playing chasey with the toothbrush. Whereas if they're laying down and their head's supported, you'll see better and you'll get a much better brush. And that's also the time to floss. And you get little holders, so you're not trying to put adult fingers in little mouths, and to get that floss in between their teeth as well. When they're young and they're what we'd call pre-cooperative, so they're not just going to lay there and let you do that, I used to put them sort of across my knee and cradle their head in my arm and do the same thing.
Oh, thank you. I've had a comment from one of our listeners who's asked, spit, not rinse. Tell us more.
The reason being that the fluoride that's in the toothpaste, that inhibits plaque growth on the teeth. So you actually want to leave that on the teeth. So you spit, encourage the kids to spit. I know, when they're 2, 3, that doesn't really happen. And so it's a very, very small little smear that you'll give them of toothpaste, but you encourage them to spit it out, but then leave it on the teeth, which is not what I was in the habit of doing when I was younger, pre my dental training. And if I'm daydreaming, I still sometimes pick up, put that water in my mouth and think, oh no, I wasn't meant to do that. But yeah, it is spit, not rinse, is the key.
There we go. That's a tip that I didn't know. So thanks for your question, Cindy, and thanks for helping us understand that a bit better. I think just circling across to food choices, talking about plaque control in the context of type 1 diabetes, the study that we're talking about showed that it was repeated hypo treatments that did elevate risk in this regard of issues with oral health in both kids. And I think we can safely say that the same thing in adults. Would hypo treatment, talk to us about hypos? We have them, we've got to treat them. Often that we can't switch off our insulin. Sometimes people on pumps can, but certainly people on needles cannot, and we have to eat something, fast-acting carbs that are often pretty sugary. Please, can you give us your tips on managing hypo treatments from an oral health perspective?
Sure. At night, when you are having to treat a hypo, I would recommend having a fluid, like lemonade or whatever your fluid of choice is. And you can even have that through a straw so that it has less going over the teeth. And then afterwards, just rinse it with water so that it's cleared of the mouth. Okay. During the day.
Can I jump in there, Robyn? So just checking, don't get up and brush your teeth?
No, because what happens when you put sugar in your mouth, it combines with the plaque or the bacteria in the mouth and becomes an acid, okay? And that acid takes about 20 to 30 minutes for the saliva to what they call buffer it or make it go back to neutral. And if you have an acid in your mouth and you brush your teeth, and if you did it once, probably if you did it 100 times, it would be okay. But if you do it repetitively, you can actually erode the enamel off your teeth. Okay, so so you're better off actually rinsing.
We have had a question from the audience about using milk to treat hypos overnight. Does that need a rinse as well?
I still would, because there's still lactose in milk. So ideally you would still, but it's probably better than lemonade. But yeah. Mm-hmm.
Terrific. Thank you. What about during the day?
Okay. During the day, it's not quite as important as at night, because what happens when you're sleeping is that you don't have the production of saliva. So what if you have something at night and then go straight back to sleep? Basically what's sitting on your teeth is going to stay there. Whereas during the day, when you're walking around, talking, etc., you're producing saliva, and that saliva is a natural cleaner in your mouth. Okay, so whereas it is better to have carbohydrates that aren't retentive in your teeth, so a lot of foods that would get stuck in your teeth will take longer to clear. So from that perspective, it's better to have a fluid. I know that sometimes it's not easy to carry around fluids with you. It's easier to have a little pack with some jelly beans in it or something like that. So during the day, if you are in a position where you can just have a drink of water afterwards, that's a great thing to do. Yeah.
Okay, so what about something like gum or mouthwash? Are they useful?
Gum is in that it stimulates saliva. So having gum is. Mouth rinses, I'm not a great fan of. If you look at the studies and when they're used in the lab, it's where they can make their claims that, so many, germs get killed, etc. The amount of time you have to leave it in your mouth is, 1 or 2 minutes, which people don't do. And it's also, it's the mechanical brushing and flossing that actually disturb the plaque. Whereas I find a lot of people that use mouth rinses, they do it because it tastes nice and then they think their mouth is clean, but the plaque's still there. And so it will continue to multiply as well. The outside of it might get killed by a little bit of the mouth rinse, but people tend to think their mouth's clean because they've used the mouth rinse. But they really need to, if you did exactly the same with the brushing and flossing and added the mouth rinse, that might be an advantage, but you don't need to do the mouth rinse if you've done the other two well.
Got it. Okay, thank you. That's really good to know and has probably saved us all a bit of money on mouth rinse. I think as well, just circling back to the hypo treatment itself, sticky lollies versus glucose tablets. Yes, you've mentioned it's hard to carry around a can of lemonade with you all the time and can be a bit inconvenient. So what about something that crumbles like a glucose tablet? Is that what you'd recommend if you had to use a solid food?
Yes, absolutely. Yes. Yeah.
Okay.
That would be better. Yeah.
Thanks, Robyn. You've given us some really good, practical, actionable tips around general dental hygiene, but also particularly around hypo management and managing our dental health around treating hypos with sugary foods. That's given us a real overview on how to do dental health and diabetes on a day-to-day level. I do want to zoom out just to wrap things up and talk for a couple of minutes about blood glucose management and the relationship between blood glucose management and dental health. Can you speak to that for us?
Yes, certainly. So if you have, your high levels, long term, if we sort of think about what happens is like we get thirsty, get dry mouth. And when you have a dry mouth, then that's because you've got less saliva, and saliva is our natural defense against both gum disease and tooth decay. So if you have high levels, you have less saliva, and you also have more glucose in the saliva, so that you have more plaque being produced, which is your gum disease, and you also have more dental decay because it's not being naturally cleaned by the saliva. So that's sort of the problem of being high. Obviously, going hypo a lot, then you're putting that rapid carbohydrates in your mouth. And if we sort of understand how tooth decay works, is our enamel, which is the outside of our teeth, is made up of minerals. And whenever you have anything that has sugar in it, which is most foods, it combines with the plaque and makes an acid, and that acid takes the minerals out of the outside layer of our teeth, or the enamel. Then what happens sort of 20, 30 minutes later, when it's neutral, the saliva puts those minerals back into the teeth. So that's a process of what is called demineralization and then remineralization. But if we're having a lot of frequency of those carbohydrates going into our mouth, we're going to have more of the minerals coming out of the enamel, or demineralization, than we are remineralization. And that's when you lose the balance of the two and the enamel breaks down, or you get a cavity in it. Okay. Mm-hmm. I should add that very first stage of tooth decay, which they call demineralization, is reversible. It is reversible until there's an actual cavity, and at that stage is when you need to have it restored or filled.
Okay. Thank you.
So
that helps us understand it at tooth level. Talk to us about gum disease and diabetes. How do we spot it? We know there's an elevated risk, but we know that can escalate. Can you just talk to us about what that actually even looks and feels like?
Okay, sure. If you look at your gums, they should be a nice coral pink colour. They're flat, and between your teeth, they come down in what's called a knife edge. When you have gingivitis or inflammation of the gums, they puff up. They're a red colour, or more red, less pink. And when you brush and floss them, you often get bleeding. Okay? And what can happen is people think they've hurt their gums because they made it bleed, which is a natural thing to think, because if you rubbed your hand and it started bleeding, the thing to do would be to leave it alone. But with your gums, it's the worst thing you can do, because what's causing that inflammation is the plaque that's sitting there. And the only way to reverse it is to get rid of the plaque. So you have to brush and floss more if you do have that bleeding. And you may need a scalp clean at the dentist as well if there's too much there, to get back to a level playing field. So that's the first stage, where it's, gingivitis. And that is, at that stage, like I said earlier, is totally reversible. But if it goes on for years and years, and then you start to get the loss of the bone around the teeth, over many years, your teeth actually start to get mobile. You see spacing between them, and it's because the structures around your teeth are actually being destroyed, and eventually they fall out. And that's actually why most people lose their teeth, is because of periodontitis or gum disease. So sort of getting into good habits, and that feeling of having nice clean teeth when you're a kid will take you through into adults, and especially if you've got diabetes, because any inflammation in the body does have an impact on your diabetic control as well. And there's been so many studies of diabetics and with periodontitis, and after they have it treated and the inflammation goes, their HB1C goes right down, not A1C, goes right down.
Wow.
Yeah.
So it really is a relationship where both feed each other. So good dental health can support good blood glucose management, and good blood glucose management can support excellent dental health. So that is a really good message, I think, to land with, and to wrap this conversation up with. Robyn, is there anything else that you'd like to add that our communities of parents and adults impacted by type 1 diabetes need to know or remember about dental health and diabetes?
Yes, well, I think prevention is definitely the key. Like treating any, like either gum disease or tooth decay is extra stress, extra burden on anyone, particularly our type 1 kids. And so prevention is the key. And part of that prevention is actually having regular dental checks. And I did do a little bit of research, and it actually shows that kids with type 1 actually go to the dentist less. And I sort of thought about that, and I just think it's just because the parents have just got burnout from all the other appointments they go to, that they probably see that as lower down the list. There is the school dental service that you can ring. There's private practices. There's lots of places wherever you feel comfortable going. But certainly that, try and add that to the list of things that is something that we need to do. Definitely.
Oh, well, thank you, Robyn. I'm definitely going to go home and brush and floss extra well tonight, and probably book in for an overdue scale and clean at my dentist tomorrow. Thank you so much for your comments tonight. It's given us not only an overview of the topic, but I think some really handy practical tips to move forward with. So thank you for your time and your expertise this evening, and thank you to everyone from the Family Centre community who tuned in tonight. Good night, everyone, and stay tuned for the rest of our series.
Thank you.